A patient walks up to your counter asking for Wayrilz. You pause. Another prescriber sends in script for Dawnzera. You scratch your head. What is that? And suddenly you see another order for Brinsupri, the first drug of its kind. These aren't sci-fi meds. These are real FDA approval of 2025 that just landed in your world. And today I'll walk you through what every pharmacist, whether retail, hospital, clinical, super specialty, or student, must know before these prescriptions hit your shelves. My dear fellow pharmacists, are you ready for Wayrilz, Dawnzera, Brinsupri at your counter? Let's break it down. Welcome to my channel, RX Indian Pharmacist. I am licensed pharmacist from RX Indian Pharmacist channel, your go-to guide to pharmacy knowledge. If you are new here, consider subscribing to my channel, RX Indian Pharmacist, for more useful videos like this. Wayrilz for hematology. FDA approved August 2025 for adults with chronic immune thrombocytopenia, ITP, after other therapies fail. Mechanism of action: reversible BDK inhibitor, oral therapy, something new for hematology. Imagine your IDP patients tired of steroids, IVIG, and hospital visits. Now an oral pill like Wayrilz could give them freedom. Your role as a pharmacist: counsel on adherence, watch for bleeding signs, drug-drug interactions, especially CYP3A4 protein. Let's discuss its realistic cost. It would cost about $17,500 per month. Insurance and specialty pharmacies will gatekeep access. Dawnzera for rare immunological disorders. First FDA-approved RNA-targeted antisense oligonucleotide for preventing hereditary angioedema, commonly known also as HAE attacks. It is self-administered subcutaneous injection every 4 to 8 weeks. The trial phase 3 data reduced HAE attacks by 81%. These results are promising. Think of a teenager terrified for random swelling episodes. Instead of ER visits, Dawnzera offers long-term control at home. You don't have to visit emergency rooms anymore. So what's your role as a pharmacist? Teaching injection adherence, teaching injection administration, adherence tracking, ensure patients recognize breakthrough attacks and have rescue meds. Let's discuss about its pricing. $57,000 per dose. Patient assistance program will be critical. Brinsupri for pulmonology disorders. First ever treatment for non-cystic fibrosis, bronchiectasis, and CFB. Oral once daily DPP1 inhibitor reduces neutrophil-driven lung inflammation. The phase 3 ASPEN trials reduced flare-ups, slowed disease progression. For decades, these patients were told no approved therapy, just supportive care. Now, for the first time, Brinsupri offers hope. Your role as a pharmacist: chronic care management, adherence. You could teach adherence, injection monitoring, insurance paperwork. You could assist patients in insurance paperwork. How much it would cost? It would cost $88,000 per year. Specialty pharmacy channels only. Wayrilz would follow orphan drug pricing model. PBMs may demand more prior authorization, requiring documentation of prior failures. Dawnzera, specialty tier with high copays, copay cards, and patient assistance, key for rare disease access. Brinsupri, likely limited distribution model. Payers will reserve documented NCFB cases with frequent exacerbations. The prescriber sends you Wayrilz. Your first call isn't to the patient, it's to the PBM to check coverage. HAE patients may finally feel relief, but without coverage, $57,000 per dose is impossible. Bronchiectasis patients might cry tears of joy at approval, but then face insurance delays. Let's understand pharmacist point of view on this. Wayrilz, educate on bleeding signs, CYP protein interactions and adherence. Dawnzera, injection technique, safe storage, rotate sites, rescue plan for breakthrough attacks. Brinsupri, long-term daily adherence, monitor side effects, oral ulcers, infections. My dear fellow pharmacists, you are not just a dispenser. You are the translator between FDA approvals and patient life. Your counseling determines whether these breakthroughs succeed or fail in the real world. Let's understand what would be the career prospects. Specialty pharmacist demand will rise. Opportunities in rare disease like hematology, pulmonology clinics would rise. Patients' life-changing convenience and outcomes. Oral versus infusion. Prevention versus ER visits. Emergency visits would get reduced. Cost versus benefits. Prevention reduces hospital burden, but upfront drug costs are enormous. The treatments seems to be costly. What would be the vision line? Pharmacy isn't just filling bottles anymore. It's navigating rare disease pipelines, coaching on RNA therapies, and leading stewardship of first-in-class drugs. Now let's understand what are the actionable takeaways. Stay informed. Flag these drugs in your workflow. Educate yourself and your patients early. Prep your counseling and scripts now. Connect with payers. Understand prior authorization and patient programs. Seize opportunities. Rare disease and specialty pharmacy jobs are growing. Advocate for patients. Push for access, affordability, and education. So friends, if you like this video, consider giving it a thumbs up. Subscribe to my channel, RX Indian Pharmacist, for more useful videos like this. See you next week in another video like this. Until then, bye-bye.